The tooth doesn't just simply pops out of its socket, right? There should be some reason that why is it coming out. That is called as your factors. Why the tooth comes out of the socket or extrudes or exarticulates from the sockets. So what happened is once Varaprasad was supposed to submit the record, so he didn't get the record. Had forgot his record in the room. So when I asked that he has to submit, today is the last date. So what does Varaprasad do? He takes his bike. He is in a hurry to go. So one of the reason is trauma. So he was on a bike and he had a fall. That's when there is a trauma. So what type of objects hits your tooth will have a greater impact on whether it is going to be a fracture, right? So if any person takes a hard object like a rod, for example, or a stick, and he hits your opponent, they both were having a fight in the department on a case. There is a pulpectomy case. So Bhavna wanted that case and Varaprasad wanted that case. So what happened? Varaprasad took a stick and he hit her. What happened? It hit her tooth. So there is an impact which produces when you hit with an hard objects like a rod or like a stick. So that leads for a fracture of a tooth. When you have an object like a ball, so he is playing a cricket and it come and hits his mouth. So this cushioning effect of the ball, when it is transferred to the tooth, the whole tooth may pop out. You understand what I am saying? The impact of the object or the impacting object is also important. When there is a hard object, it may cause a fracture of a tooth. Whenever there is a cushioning or a resilient object which hits your tooth, would cause your exarticulation or a avulsion of the tooth. Along with that, it is also important on the site where it is making an impact. For example, whether it is making an impact at the incisal edge or at the center of a rotation where the whole tooth pops out of the socket. Okay. So we see this kind of avulsion injuries more common in the younger population. Yes. Why do you think the last girl? Why not very common in older and why common in a younger? You could be wrong, not an issue. You could attempt to answer. If someone wants prompts, they can get up and answer.
They will be mischievous, but more active than old age people.
More active. Yes. Yeah. At certain age, the children should be quite active. Yes, I agree with that. But here, what I am asking you is like, why more common in younger population than the older population? That may be one of the reasons. Any other reason? Sit. You can sit and answer. No need to stand. Any other reason? Think. The tooth has to just come out. One may be the age. They are more active in the younger age groups. So they play cricket or they do activities. So that may be the reason for a fall, and that's why the avulsion may be common.
Bone is still developing.
Bone is?
Still developing.
Bone is more pliable. Bone is already developed. The tooth would be in a developing stage. Okay? So the bone is pliable. That means that it's not very hard. So it's slightly, resilient or flexible in nature. Not very much flexible, but yes, when you extract a tooth in a younger population and you extract a teeth in an older population, you could feel the difference. Right? So the bone is quite pliable when compared to the older population. So whenever there is a trauma to the anterior tooth or the tooth in per se, the avulsion of tooth in a younger population is quite common compared to the older population. Okay. The other reason would be a crown tooth ratio. In a developing child like around 10 years or 11 years. So this is how the questions are asked in your exam. A 8-year-old boy had an avulsion. So elaborate a treatment plan or add a note on management of the tooth. So you should understand that what exactly the examiner is asking you. So 8 years or 9 years, that means that the anterior tooth erupts at the age of 6 to 7. So the root completion would take 3 to 4 years. So around 10 years, the root completion would take place. So he is asking you about an avulsion in an immature tooth or an open apex case. So your answer should be to elaborate a treatment plan for your immaturity. Is that clear? So you need to know the age of the child or the patient, what they are mentioning, and what exactly they are asking. Sometimes it is like it is class 3 fracture. Sometimes it's exarticulation or avulsion. So you need to know the components and then answer accordingly. Okay. So in the younger children, bone is pliable, more mischievous, they tend to play. That is why there is a trauma to that. So the younger age group patient. So what are the clinical features? So a patient came to your clinic. So how would you go about? What you want to do first? What you do generally, a patient comes to your clinic, you have a trauma. So what do you do? Call a postgraduate student. Ma'am, trauma case has come, please come, I do not know how to manage. Or call a staff. If it's your own clinic, you have to manage your own. You don't have any PGs there, any staffs there. So how you do? A patient came to your clinic, what you want to do? You do not know, there is a trauma. So what is the first thing you would do?
Yes, pain is there.
Okay, pain is there or not? Definitely he had a fall. So either he is an eternal that he does not have a pain at all. Yes? He definitely have a pain. He have a pain, so only he had come to you. That's an Indian scenario. Whenever patients have a pain only, they come to you.
When did it happen?
Very good. Yes. First, you want to take a brief history. When did it happen? When? That gives you a time duration, that how long is that tooth out of the socket. Yes, that's a very crucial factor when you are treating an avulsion case. For how long the tooth is out of the socket. Okay, when did it happen? Where did it happen? So did it happen in a room? Did it happen in a playground? Or somewhere else? So that gives you an idea about contamination. Whether that particular tooth which was avulsed is contaminated and you need to do anything else, you need to condition that tooth. Or is it not contaminated? Yes? When? Where? Then? How? How did it happen? Whether the rubber ball came and hit the tooth, or was it a rod, or was it a wood? How did it happen? Okay? Then what else you want to ask? You are bothered about the teeth. But what if the patient goes back and he goes to a coma? Was there any change in the vision, or a double vision, or an altered vision? This gives you an idea about any possible reasons for your brain injuries. He had a fall, it's not only your teeth. Definitely there would have been internal hemorrhage in the brain, which could cause loss of consciousness, vomiting, and your blurring of vision or a doubling of the visions. So you need to take the brief history before you start or jump into treating the case. Yes? So that is your clinical history taking. Along with that, you need to take your complete examination. You wear a gloves, you check for any bone fracture or discontinuity in the bone. Then you see if any portion of the tooth is fractured inside, or is it there, only the crown has gone at the gingival level or cut till the gingival level, or the whole tooth has come out. When you ask a history, the patient will tell the tooth had completely come out, and sometimes they will carry it along with them. Or sometimes they will say that I don't remember because it so happened in a hurry that I was not able to recollect, it started bleeding and I had rushed to your clinic. So you need to do a thorough clinical examination and check whether is it a fracture or dental fracture, or is there any fracture of the upper jaw or a lower jaw, or the whole tooth has come out. After this, you want to do an investigation. So that's a standard treatment protocol. I don't want to go in detail. It's a basic trauma thing. So what examination you want to do? What you want to take? You want to take a radiograph. So what do you find? What do you see on a radiograph? You could see a fracture line. Sometimes, but not very definitive. If you want to see a fracture line, you need to take in different angulations to analyze the whole trauma tooth to see whether there is a fracture line somewhere else. Okay. Otherwise, you could see the whole tooth which is come out. There is an empty socket. There is nothing in the socket. Or there may be a apical, the fractured piece only at the apex of the tooth. Yes? Or there is a fracture at the cervical area, where at an outside it seems like an avulsion, but inside there is a tooth piece which is left. So take an IOPA to confirm what is the type of injury. Okay? So now we'll come to a management part. How do you manage? Yes? Varaprasad is in the clinic. So his friend has met with an accident. So he knows that Varaprasad is a great doctor, so let me give a call to him. I have a dentist friend, at least let me utilize him at once. Otherwise, anyways, he doesn't help me out. So what he does is, he calls him up. He calls him up and he says that my tooth has come out. So this is called as on the site of injury. Most of this is common in a foreign population, that where they have awareness about this dental trauma and dental knowledge, where they call up the dentist and they ask, यहाँ पे क्या होता है? दांत गिर गए, निकालो, पकड़ो, keep it in a pocket, or sometimes just throw it and come to a dentist. Right? If at all an educated, aware patient who is having an awareness would call a dentist or a dentist friend or any doctor, at least for that matter. Okay? So, what do you do? Yes, Varaprasad, what advice you want to give to your patient when he has come with the trauma, or he says that his whole tooth, he was going on a bike and had a fall and the tooth has come out? Yes? Preserve the tooth how? So if you tell to the patient, preserve the tooth, a very nice terminology. So what does the patient see? Preserve like what? How? How to preserve it? He does not know the definition of preservation. So you need to explain him to the language where he understands. What do you say? What do you say? कोई प्रॉब्लम नहीं, उसको फेंक दे, मैं इम्प्लांट लगाऊंगा.
Exactly.
Yes? Commercial dentist. What do you say? Just you got a call. What you would like to ask him or say him, advise him? You can be wrong, but it's fine.
Put it in a milk or
Okay. She wants to say his patient that put it in a milk or you could keep it in the buccal vestibule and get it. Very good advice. It's in dirt, it's in mud. So madam had told me to put it in a milk. So just he picks it up along with some mud and then he puts it in there and he gets a mud shake. Right? Is it going to work? No. So what you should do? Clean it. So you had told him to clean it. So the patient is very, doctor had told me to clean it. So he takes it, scrubs it nicely all over, cleans it and then puts into the milk. Is it acceptable? No. So how do you wash it? Yes. You need to advise to the patient that how he needs to hold it, how he needs to wash it and how he needs to get it to you. Right? So that's why your advice will be more important. So you ask him to hold the tooth at the crown. Okay? So crown, again they will not understand. You should explain them, which looks like the outer portion of the teeth which sees. That is the crown. So hold it, wash it in a slow running tap water and then put it in a box which consists of at least HBSS is ideal, but we cannot ask him to waste his time searching whole Raichur to get an HBSS. We never know is it available or not. So we could at least ask him to put it in a cold milk or a coconut water and get him to the clinic as soon as possible. Is that clear? So that is management at the site of injury. So you have got a call and you are informing him. Or you yourself who are present there, or the PT teacher or the trainer who is present there and he sees a child who had got a hit with a ball and the whole tooth is avulsed. So you could advise him to slightly wash in the running tap water and place the tooth back into the